How did you discover Curodont Repair and why did you decide to adopt it?
I discovered it first in Switzerland because I'm a Swiss dentist, and there was a study in the University of Geneva that came out, and I saw the first results, and that was something like mind-blowing, so I adopted for the technique.
How did Curodont Repair change your approach to caries management?
Instead of waiting and letting something grow, we arrest the cavity in the early stage so that we can heal the tooth before it becomes a decay.
What has Curodont Repair brought to your clinics?
So in my clinic's Curodont Repair is not only used by the doctors, but by the team, so the dental hygienist applying it. And so the feedback from the patients is amazing because instead of drilling and filling, so they get along without no pain and non-invasive.
How do you present Curodont Repair to your patients and what is their response?
I present it with my diagnostic means, so I use the X-rays, and so combining it with AI gives me a very smart approach in order to see where the initial lesions are. And if you explain it to the patients and you have a tool today that helps you to stop the cavity, they always say yes.
What advice would you give to dental practice owners who are somehow hesitating in adopting Curodont Repair?
I would stop to hesitate. I would go because in your setup there is no extra techniques or investment to be done. You can go straight forward, taking it on your normal diagnosis and implement it into your routine workflow.
How has the use of AI enhanced your ability to detect and provide the solution to early caries with Curodont Repair?
AI helps a lot, especially for the diagnostics of bite wings, so that you can really put numbers to the lesion, and even the initial lesions, when they are highlighted on the screen, the patient gets it very well, the communication is efficient, and the technique is going to be adapted.
How does the combination between AI and Curodont Repair benefit patients?
This is a killer combination because you get the right diagnostics, it helps you with the communication, and if you explain in a few words how the technique is applied and it's painless and it's non-invasive, everyone loves it.
How has the use of Carvo enhanced your ability to detect and provide the solution to early caries with Curodont Repair?
In addition to my X-ray diagnosis, I always apply the DiagnoCam from Carvo, so to have a transillumination image that helps me to detect the interproximal cavities very nicely, and it helps me to follow up when I do the treatments in order to see the regenerative effect.
How does the combination between Carvo and Curodont Repair benefit patients?
It's a killer combination because the Curodont Repair does the treatment, but it does it over a few months of treatment time. So you need to document it, and if after 3 months I want to follow up on the technique, I use the Carvo DiagnoCam to compare the images instead of waiting a year for the X-rays that I take at least 1 year later. Well done.